The pandemic has taken over every sector of our lives, and those dealing with other serious issues have struggled because of it. Our Danae Bucci has a State of Addiction report on the epidemic within the pandemic.
When people find themselves home alone and without their support systems, without their sponsors, a lot of people are going to reach back.
An epidemic within the pandemic, the cure to one deadly phenomena being the disease to the other.
They don't want to feel that. They don't want to feel it.
We just love her so much.
Savannah native Tammy Smith is a long-term recovering drug addict.
Personally, I have seen a lot of people relapse during this time.
While the opioid fight has been going on for decades, the isolation from COVID-19 could undo our progress.
COVID-19 is almost like a series of lightning storms that are just accelerating the problem. And so we need to urgently turn our attention to this and start thinking, about how to actually address this crisis in concert with the ongoing COVID-19 pandemic in the United States.
According to recent data from the Georgia Bureau of Investigations, the state has seen a significant uptick in opioid-related deaths. Now, this graph shows the number of deaths that have happened in Chatham County between January and June, starting back in 2014. Last year, deaths were up over 40% from the 2018 high in just the first 6 months. It's a number that's certain to rise as the state continues to investigate 600 other deaths that could be opioid-related from the back half of 2020. Also in that data, the average age of people overdosing in 2020 dropped to just 36, nearly 5 years off the average from previous years. Would you say that these increases are statistically significant?
It's early data. We don't have a national picture quite yet of the overdose death numbers during COVID, but reporting in many states are seeing 30, 40, 50% increases. Those are certainly significant.
With Georgia's 60% increase, local recovery efforts have had to make changes to try and get ahead of the trends.
There are new innovations, I think, as a result of COVID-19, and we need to listen to folks who are most affected by this crisis and understand what works and what we can do better and what we can expand out.
Recovery community organizations, or RCOs, have been finding ways to fill the void. That didn't exist when Tammy Smith began her recovery, but now she's using them to help others.
I was introduced to becoming a certified peer specialist.
Now she wants to give others the tools to gain full recovery over the disease that had a hold over her life.
For 3 years, I was part of that peer program, and I saw magic happen. I saw people that began to love themselves, began to have pride in themselves, began to want to dress nicer, to take care of their hygiene. Beautiful things happening.